morning, students! Welcome back to Mary's World of Science! The respiratory and circulatory system are the two important organ systems of our body. However, we sometimes use our body to the extent, to the point that we forget to take good care of our body until we feel something bad in it. This is the reason why we're going to discuss today some of the common diseases in our respiratory and circulatory system. But for today, let us focus our discussion with the diseases or common diseases of the respiratory system. This includes asthma, bronchitis, emphysema, influenza, lung cancer, pneumonia, and tuberculosis. As we go along with the discussion, we will encounter the word inflammation. Say for instance, a harmful thing enters your body, such as the one in the picture. Our response may be triggered that may cause some symptoms such as pain, swelling, warmth, and redness. These are all attributed to inflammation. Now, let us discuss the diseases in respiratory system. First, asthma. It is one of the most common long-term ailment or diseases to children, but adults can have this too. Asthma causes wheezing, breathlessness, chest tightness, and coughing at night or early in the morning. It may be caused by allergies such as pollen, smoke dust, or stress and anxiety. Asthma is a chronic ailment that causes the inflammation of airways, bronchi, and bronchioles. So why do inflammation occur? This is due to the allergic reactions, stress, or anxiety during asthma attack. This is the normal person's airways. And this is the asthmatic airways. And when the allergen comes in contact with the inflamed airways, it tightens and becomes narrow, making a person hard to breathe.
To treat asthma, doctor recommends the use of inhalers. This device contains gas that can relieve and prevent symptoms of asthma. Many inhalers contain steroids like prednisone to treat inflammation. Others have a type of drug known as bronchodilator to open up your airway.
Next, bronchitis. It is the inflammation of the lining of the bronchi. As you can see, this is the normal person's bronchi. And this is the bronchi of the person suffering from bronchitis. Next, emphysema. It occurs when the alveoli in our lungs are destroyed. As you can see, this is the normal person's alveoli. Now, in people with emphysema, the air sacs in the lungs or the alveoli are damaged. Over time, the inner walls of the air sacs weakens and ruptures, creating larger air spaces instead of many ones. Right now, let us discuss influenza. Influenza is a viral infection that attacks your respiratory system. It may be your nose, your throat, and your lungs. It is commonly called flu, and it is highly contagious.
At first, the flu may seem like a common cold with a runny nose, sneezing, and sore throat. But colds usually develop slowly, whereas the flu tends to come on suddenly. And although a cold can be a bother, you usually feel much worse with the flu. And here are the common signs and symptoms of flu. First, fever. Then, aching muscles, chills and sweats, headache, dry persistent cough, and shortness of breath. So these are the symptoms of the flu.
Next, lung cancer. It is the leading cause of cancer death worldwide. Lung cancer is a type of cancer that begins, of course, in your lungs. People who smoke have the greater risk of lung cancer, though lung cancer can also occur in people who have never smoked. The risk of lung cancer increases with the length of time and number of cigarettes you've smoked. Now, if you quit smoking, even after smoking for many years, you can significantly reduce your chances of developing lung cancer. So, to those who are smoking out there, it's better for you to quit smoking now.
Okay, so lung cancer typically doesn't cause signs and symptoms in its earliest stage. Signs and symptoms of lung cancer typically occur when disease is advanced. Signs and symptoms of lung cancer may include a new cough that doesn't go away, coughing of blood, even a small amount, shortness of breath, chest pain, hoarseness, losing weight without trying, bone pain, and headache. These are some of the symptoms of lung cancer.
Now, let us discuss pneumonia. It is an infection that inflames the air sacs in one or both the lungs. The air sacs may fill with fluid or pus, or we call it the purulent material, causing cough with phlegm or pus, fever, chills, and difficulty in breathing. Viruses, bacteria, and fungi can all cause pneumonia. A common cause of bacterial pneumonia is Streptococcus pneumoniae or pneumococcus. Last, we have tuberculosis or TB. It is caused by a bacterium called Mycobacterium tuberculosis. The bacteria usually attack the lungs, but TB bacteria can attack any part of the body, such as the kidney, spine, and the brain. And if not treated properly, it may lead to death. And these are the respiratory diseases or the respiratory systems diseases. If you want to have a longer life, take care of your body and avoid smoking. Thank you for watching!